All right, let's dive right in. Today we're going to talk about something huge, a really profound shift in how we understand human behavior. It's this whole perspective known as trauma-informed care.
You've definitely seen this before. Heck, maybe you've done it yourself. A tiny, throwaway comment leads to a massive outburst. A minor snag in your day feels like an absolute catastrophe. It's confusing, right? But what if those reactions aren't random at all? What if they're actually echoes from the past?
And that really gets to our first big idea here. It's about moving past labeling things as problem behaviors and starting to see them as stories. It's about recognizing that there is almost always a backstory that we just can't see on the surface.
This leads us to a major mind shift. What we might instinctively call bad behavior is often a trauma response. Now let's be super clear, these are not character flaws. They're survival adaptations. Think about that for a second. These are strategies the brain literally developed to help a person get through something totally and completely overwhelming. So, why does this even happen? Well, to get it, we've got to look inside the brain, at its incredible built-in alarm system. And this is so key. It has absolutely nothing to do with willpower. This is pure brain science, pure neurobiology.
Okay, and this part is just fascinating. Picture your brain having two main players on the team. You've got the thinker. That's your prefrontal cortex, the part in charge of all the logic and planning. But then you've got the alarm, the amygdala. And here's the kicker. The alarm is so much faster. So when it senses a threat, even if it's just a faint echo of a past danger, it slams the panic button before the thinker even knows what's going on.
And once that alarm is blaring, it is game over for conscious choice. The body just takes over, automatically shifting into survival mode. Now, this can look a few different ways. Let's quickly run through the most common responses.
First up, you've got fight. This is the body trying to overpower the threat. It can look like aggression, being defiant, or really needing to control the situation.
Then there's flight. Pretty self-explanatory, right? It's all about getting away from the danger. This might look like avoiding people or situations, feeling super anxious, or even just being constantly restlessly busy.
We also have freeze. You know that deer in the headlights feeling? That's it. It happens when fighting or fleeing doesn't seem possible, so the system just gets stuck. You might feel numb or totally spaced out. Now here's one you might not have heard of. Fawn. This is when the brain's strategy is to try and please the source of danger to avoid conflict. It often comes out as intense people-pleasing and having a really hard time setting boundaries. And finally, there's flop. This is what happens when the nervous system is just so completely overwhelmed that it gives up. It's a state of total surrender, almost like a physical or emotional collapse. Okay, so understanding all of these responses, fight, flight, freeze, fawn, flop, it all leads us to the absolute core of this perspective shift, the real heart of the matter. I call it the one-question revolution, because this simple change unlocks everything.
It's the move from one simple question to another. We have to stop asking, what's wrong with you? Can you just feel the judgment in that, the blame? And instead, we have to start asking, what happened to you? Feel the difference? One question points a finger. The other opens a door. It's a shift from seeing a pathology to seeing a personal history.
Dr. Sandra Bloom, who's a true pioneer in this field, just captured it perfectly. And it's so powerful because making that one little change in how you ask the question, it can completely transform how you see other people and even how you see yourself. It swaps out all that judgment for real empathy.
So, okay, we ask, what happened to you? Then what? Well, that's the best part. This isn't just theory for understanding the past. It gives us real, practical tools we can use right now to build safety and empowerment in the present.
This whole approach is really built on a solid foundation of 6 guiding principles.
Think of these as the essential building blocks. It all has to start with safety, both physical and emotional. Then you need trustworthiness and transparency. You bring in peer support and collaboration. You focus on giving people empowerment, a voice, and a choice. And so importantly, you have to look at everything through the lens of cultural, historical, and gender issues.
When you put all those pieces together, you create an environment where people can actually heal because they finally feel respected instead of judged.
And one of the most powerful and practical tools that comes from this is something called grounding. When that brain alarm is going off, you need a way to tell your body that you're safe now. A super simple way to do that is the 5-4-3-2-1 technique. You're just using your 5 senses to yank yourself back into the present moment. By naming things you can see, feel, hear, smell, and taste, you're sending a direct message to your nervous system that says, hey, I am right here, I am safe. It is an incredibly effective way to calm that survival response.
So, why does all of this matter for every single one of us? Because this isn't just a clinical practice for therapists. It's a way of being human that can create these amazing ripples of healing throughout our communities.
The renowned trauma expert Dr. Bessel van der Kolk puts it this way: trauma isn't just the event that happened in the past, it's the imprint that experience leaves on our mind, our brain, and our body. And that's exactly why a compassionate, informed response is so critical. Because the effects are real, they are physical, and they are lasting.
And if you take one thing away today, let it be this. This is not just for professionals. It's a fundamental human skill. It doesn't matter if you're a parent, a teacher, a manager, or a friend. Adopting this perspective gives you the tools to respond with way more humanity and, frankly, way more effectiveness. Which really leaves us with a final thought. This doesn't require some big, grand gesture. Sometimes it's as simple as just pausing, choosing curiosity over judgment, and creating a little space for someone's story. So the question to leave you with is, how can you, in your own life, create one small moment of safety for someone today?